One of the country's most commonly prescribed drugs. There's new research linking levothyroxine, also known as Synthroid, to bone loss. The medication is often prescribed for underactive thyroids. Joining me now to break down the reports is physician and public health specialist Dr. Yalda Safai. Dr. Safai, this, of course, is concerning to many. Can you walk us through these findings just a little bit and describe the correlation to bone loss faster than those not on Synthroid?
Sure. I got to point out here because I don't want anybody to panic. This is a very widely prescribed medication. So this study had several limitations. It was only done on I think a sample size of like 50, very small. In general, for a study to have strength, you need it to be done on thousands and thousands of people. And it only looked at a small subset of the population, those over the age of 75, which are already vulnerable to osteoporosis and bone disease. And I have to note here that if you've been diagnosed with thyroid disease, you're already at a higher chance of bone loss. So this study showed that there's a correlation between this medication and bone loss, but it doesn't prove causation because the disease in itself can also cause bone loss. So there's much more research that needs to be done on this medication before we change our prescribing habits.
Dr. Safai, I'm so glad that you said that you made it clear that there was correlation but not causation. Why is that so important for those who might be on this medication?
So it's because I don't want anybody to panic, right? This is a widely prescribed medication. It's necessary. Keep in mind, when we take into account whether to prescribe a medication or not, we weigh the risks versus the benefits. The risks of not treating thyroid disease are so severe that the risk with this medication far outweighs, the benefit of this medication far outweighs any costs or risk that might be associated with it. So it's really important for people who have hypothyroidism to not panic and still stay on this treatment regimen, because the consequences of not treating hypothyroidism is much more severe.
That, and you were also concerned about that sample size. You're like, Nick, this was a very small sample, so I don't want people to blow this small sample in this specific study out of proportion. What about the some 23 million Americans who use some form of this medication to treat thyroid conditions? What should they know about their treatment plan? Should they make any sudden changes, or, as you probably are going to suggest, talk to your doctor?
Of course, no, I wouldn't recommend doing anything in terms of taking the medication itself. But now here's what's very important. You need to start strength training early in life, whether you have thyroid disease or not, because strength training early in life will prevent something like this from happening, or it will delay it. So with this medication or with thyroid disease, they're saying that the bone gets more frail, and in turn, it puts you susceptible for risks for fractures, right? So if you start strength training early in life, as soon as you are diagnosed with hypothyroidism, it might delay or prevent any issues like this.
Dr. Safai, before I let you go, I do want to ask you one last question, though. There are also questions on who really needs the treatment. According to the Yale School of Medicine, about 90% of people on the drug may not need it. How does someone know if it's time to switch treatments and reduce their risk of the disease?
Sure. The only way to know that is take someone off the medication and watch their thyroid levels, which comes with risk. So I think every person needs to assess their own individual risk, talk to their doctors and see if they are okay with experimenting with this. Usually hypothyroidism is a lifelong disease. That's why people stay on it most of their lifetimes, right? But the only way to know whether they don't need this anymore is to cut the medication and monitor the thyroid levels, which comes with risks.
Dr. Yalda Safai, I have to tell you, the takeaway for me was causation and correlation are two very different things. Thank you so much for your help this morning.
Thank you for having me. Stay healthy.
And happy holidays.